Hi, everyone. It's Dr. Angela Natoli of the Chiropractic and Functional Neurology Center. With me again is Dr. Karla Mehlenbacher. How are you, Karla?
Hi,
Good. And she has her sidekick over there. Do you want to introduce her?
this is Madeline Mehlenbacher.
Hi,
She's my helper
Madeline.
today.
All right, so she's going to help us today. So a common topic right now is, since everybody is in their homes and most parents are homeschooling now at this point, a very common topic that we're seeing is, how do I get my child to concentrate better? A lot of parents are thinking that it's abnormal for children to want to get up and move around, and we're here to just tell you that, first of all, that's completely normal, right? Because kids are supposed to move around and run and play and do those things when they're younger. So sitting still is really a higher brain function. So first of all, never think that your child is abnormal for wanting to play. Is that correct, Karla? Would you agree?
Yeah, so I mean, we know that the highest form of motor control and cognitive control is to be able to sit still. This is why these monks are the ones that have the most control. But movement just means that your body is needing that. So I would say that the best thing for the homeschooling is to start your day with movement first, and then try and get them to sit still and do their work, because that's what their brain is actually asking for.
Yeah, so burn off a little bit of calories, get out some of that energy, kind of activate the brain a little bit, and then have them almost like having recess time first, right?
Right. I mean, kids' brains are getting a million new neurons a day, and they need to be integrated. And that's why they're constantly moving, because it takes 3 decades to develop this system. So they're constantly needing that external environmental stimuli to keep building those building blocks. So it's always good to start with movement first, get the brain calm, feeling safe, and then try and challenge the cognitive part.
Right. So it's important for parents to understand this is completely normal. So one of the good things to do would just have them play for a little bit after they eat breakfast. Again, maybe take away stimulating foods for them, real high sugar foods, refined carbohydrates. If you have a real picky eater, probably reach out to someone like us or someone who does functional medicine, and see if there can be some testing or some allergies or something there, and figure out why they're such picky eaters. Because we know that breakfast and lunch and dinner now are all at home, and that could be a little bit of a challenge, correct?
Mm-hmm.
Yeah, so taking some of the stimulants away can help, and then doing some exercises first. And then if they are still high energy and have an inability to focus, we can go back to our foundations, our building blocks of brain development, right?
And I could show you some basic core exercises you can do if you are thinking like, I don't know what you mean by this, like what exercises can they do? So let's show them the bird dog, right? So on tabletop position. And if they're just starting out, we want to do one limb at a time. So make sure they're pretty even, and then hold one arm out in front of you. And so she's just going to be holding one limb at a time. You look about a foot in front so you don't strain the neck. And you want to see if they're starting to shake like they're getting weak already, then they can take a break and go back to it. But the goal is to get to about 90 seconds. And then if they are advanced, you can do leg and arm at the same time. So switch. This leg, this arm. Yep. See, that's a little bit harder. The older they get, the easier this is. But being able to do this core exercise is calming to the brain. And then go ahead and relax. If they're just starting out, just do one limb at a time. So start with one arm, then just one leg. If you can only do 20 seconds, just do 20. So just do one leg, put both arms down. Straighten it. So you bend, flex the foot down, keep your eyes up here, and then try and hold it. So you can see she's already getting a little shaky, but that just says that we need to keep working on this, and that's something that happens really quickly. If you do this every day for a couple of weeks, she'll be able to do it very fast. The other one, is a nice simple one, is the bridge. So lay on your back, and then lift your hips up. Yep, keep your feet a little bit apart, and then you want to have them hold their pelvis up. So as long as they can go, you time them. You want to again get to about 90 seconds. The advance of this is being able to go in prayer position. So put your hands like this in front of your chest. So they're not using their arms for support. And then the even more advanced one, put your arms back down, lift your hips up, and then straighten one leg. So you keep it level with your knee. So that one's really hard. So those are great exercises that are good for everyone, that are great ways to get the kid nice and centered in their body before they try and do their homework.
Start any schoolwork or start their day type of a thing. So what are some things that parents may notice when their children are doing their schoolwork now at home? What are some things that they may notice to say, okay, yeah, my child's a little bit extra distracted?
Yeah, I mean, the biggest ones are a lot of postural reflexes. If they can't sit still in the chair, they're constantly fidgeting. A really common one is auditory perception. So this is when we feel the safest, we can have a conversation with someone. And this is all developing in childhood. So when we feel safe, we can hear high frequency sounds, which is an adult voice or a human voice, especially a female human voice. But if I'm not in that place of integration of my inner ear system, I might be perceiving low frequency sounds all the time, and I'm constantly distracted because I can't tune in with this high frequency sound because I'm still overstimulated by all the low frequency predatorial sounds. And this is very distracting. So if you do see your child having this, which a lot of kids can have this and it's completely normal, but things that we do in the office, and it depends on the individual, are things like vestibular rehab or inner ear exercises, sound and auditory stimulation. So you can do like metronome and rhythm, make them have to do things to the beat so they hear it at the same time that they feel it. Metronome is a super great one. There's free apps on smartphones that you can download, but you want them to actually feel their body and the rhythm. You can do sounds and frequencies. If you want to get specific, you can reach out to someone that, like us, that does this. But there are a lot of things that you can do to help prep before you get them sitting down to do their homework and get them centered in their body, feeling safe. That way they can do those things that their brain has the ability to do once the foundation is taken care of.
So the basic things would be a good breakfast, good meals, lower in sugar, some exercise in the morning, and maybe a couple times throughout the day. It doesn't have to be just be in the morning. They may need more breaks than that. Give them more recess time, and then do some of these postural exercises like Dr. Karla is showing on Maddie there, to kind of increase concentration in children. And then still, if they're having issues with auditory and distraction sounds, then reach out to one of us, or we can find someone close to where you live, and we can find someone like us that can possibly help you with that. And that could make some of this homeschooling a little bit easier for parents.
Yep, exactly. You got to go back to the basics, just like when they were a baby. It sounds simple because it is simple. It's complex, but you got to see how babies develop and then go back and do those things.
Yeah, and start from the beginning. So moms and dads, if you're at home homeschooling and having any issues with concentration, auditory issues, having children not be able to sit still, please leave us a comment, reach out to one of us, and we're happy to point you in the right direction to help you out. And we hope some of these foundation exercises help you and your kids. So have a wonderful day. And once again, thank you, Dr. Karla.
Thank you.
Thank you, Maddie. Bye.